it's the right thing to do. Many chronic diseases like cardiovascular disease and diabetes are preventable, and businesses are in a perfect position to help employees to get healthier. But it also makes business sense in terms of reducing healthcare costs, reducing the time employees are away from the office due to health issues, also increasing productivity, and reducing early retirement due to health issues, either of the employees themselves or their loved ones. In the US, employers spend over $500 billion a year on healthcare costs. This is an increase of over 60% over the last 10 years. It's crazy to think that Starbucks spends more on employee healthcare costs than it does on coffee, and General Motors spends more on employee healthcare than it does on steel for its cars. Improving employee health and well-being is not only the right thing to do for businesses, but it also makes strong business sense to improve their financial bottom line. There's limited leadership in this space. There are some great examples from inside and outside businesses, but they're few and far between, and particularly when it comes to small and medium-sized businesses. Also, some of the incentives for employers aren't well aligned in terms of the amount of investment they have to put into employee health and well-being and some of the benefits they get out of it. There's also an issue with some of the research, both in terms of the volume as well as in terms of the quality of that research. There are also issues with regulation, which doesn't necessarily support evidence-based practice. And finally, we're not really capitalizing on the benefits you can get between combining business activity in this space and community activity to address some of the underlying issues that both are trying to tackle. We need to improve the level of leadership, both inside and outside businesses, calling for this as a critical component of the strategy to address some of the issues that the US is facing in healthcare. We also need to better align incentives between employers that do invest in health promotion and disease prevention of their workforce and them getting some of the benefits out of that. We also need to invest in more and better research. There's a need for better regulation to encourage businesses to invest more in evidence-based health promotion within their businesses. And finally, we need better coordination of community and business programs to help address the underlying issues that both of those parties are trying to address. The Vitality Institute is a strong advocate for health promotion and disease prevention across the US, and in particular for employee health and well-being. It's bringing together leaders to help work together to invest in prevention, as well as starting very specific initiatives to overcome some of the barriers to employers investing more in the health and well-being of their employee populations.